All right, hello everybody, and welcome to our first episode of exploring healthcare professions. And so today we're going to be discussing with Cassidy Troup. So she is a current doctoral student at the University of Health Sciences and Pharmacy in St. Louis, and she's also obtaining her MS in Medical Cannabis Science and Therapeutics at the University of Maryland in Baltimore. And we're going to be talking about exploring pharmacy. Did I hit everything right, Cassidy?
Yeah, I think you've got everything there, Jacob. I'm in my 6th of 7 years of pharmacy school, and I'm completing my first of 2 years in the master's program right now.
Awesome. So, with that, then I just want to say, how is it? Like, what is it? What is it like in your field? And maybe explain a little bit more, because I'm sure not everybody knows exactly who the pharmacist is when they go to a pharmacy, and what are all the rules that you can do in a pharmacy.
Yeah, so when I got started in this program, I wasn't really familiar with what a pharmacist actually did, and how integral of a role pharmacists play in the healthcare team. And essentially, what most people are familiar with is the pharmacist who works at Walgreens or CVS. And that would be what's considered a community pharmacist or a retail pharmacist. And their job is primarily to double check all of the doctor's prescriptions that they send out for patients and to facilitate safe medication use by, your mom, your dad, your grandpa, yourself. um, I learned also about an entirely different side of pharmacy, which is like the healthcare system pharmacy. So pharmacists who are working in hospitals, they essentially verify and correct every single medication order that comes through a hospital. So they're sitting downstairs, they are in control of all of the different medications that are getting dispensed, and they are the ones essentially responsible for keeping everybody safe when it comes to medication usage. We are the drug experts. There are no other members of the healthcare team who receive as much intensive training as us in terms of the medications. And we are the ones that doctors come to for advice, nurses come to for advice. Everybody from administrators to physical therapists, they're asking pharmacy, what do we think? And it's integral. Half of the, disease states that come across, the fix is a medicine. So we're gonna be, crucial to that healthcare team for as long as people are being people.
Awesome. And I think that's an interesting point that I don't even think I thought about, that idea of, like, you go to your doctor, you get the prescriptions, you maybe go like talk to your nurse or your therapists, but they all so you're kind of like the point person in a way. Is that what
Yep.
you're saying?
Yeah, and the way I think about it, because I currently work in a community pharmacy, the way I think about it is we are the last healthcare line of defense between patients and some of really like potentially dangerous drugs if they're used incorrectly, or, we're the last point of contact for a lot of patients. And we pharmacists are considered the most accessible healthcare provider because we are actively in the community every day, like working with patients directly to try and tailor their healthcare needs. And, we kind of, at least in my pharmacy, we have a pretty close relationship with a lot of our patients in a way that we can, have open and honest communication with them in a way that they won't necessarily have with their doctors, just because they don't necessarily see us as that sort of like limited healthcare professional. We're able to, have real conversations about their lives because we're in such an open environment.
Nice. Awesome. That's definitely I never thought about it that way. So I hope that anybody that watches this will also see it in a new light.
Oh yeah, pharmacy's kind of cool. I'm kind of into it. It's no big deal.
So then I guess the next big question for many high schoolers and kids is, how long does it take to complete something like this? And is it a good financial decision in the short term and in the long term? Because I know not everybody has those means right away. So yeah, go ahead and go with that.
Sure. So I graduated from East Peoria High School, right there, local. I am not from a wealthy family. I don't have and I have not had a lot of financial support from my family during this. So basically, the program that I'm enrolled in is a 7-year straight from high school program. I received my bachelor's in health humanities in 2019. So at the end of all of this, I will have 3 degrees. The program that I'm in at UHSP is really cool. Sorry, I thought there was a bug. It is really cool because I don't have to take what's called the PCAT, which is like the pharmacy entrance exam to get into pharmacy school. So they have a really unique, program where I can meet all of my requirements and be directly admitted without taking that additional step. A lot of pharmacy programs are 6 years, but they don't get you a bachelor's degree and your PharmD. So for example, in St. Louis, the 2 major pharmacy schools are my school, and then Southern Illinois University at Edwardsville has a pharmacy program. And what they do is 2 years of pre-pharm and then 4 years of pharmacy school. There's good and bad things about that. Like I said, if you decide that you don't want to be a pharmacist in your 5th year of school, you don't really have anything to show for it. And luckily, if I had decided to walk away after year 5, I would at least have a degree in my pocket. In terms of finances, there's a lot of options with pharmacy school. So the way I thought about it was, if I go to a private institution, which I decided to, I have a lot higher chance of getting scholarships. State universities often give, pretty decent rates for in-state tuition, but their amount of scholarships are significantly less compared to private institutions. So that's kind of what played into my decision to go to UHSP. I'm still used to calling it Stillcop, so I keep pausing before that. They recently changed their name from the St. Louis College of Pharmacy to the University of Health Sciences and Pharmacy. Okay. So yeah, we're still technically Stillcop within the university, but they're expanding their different degree offerings to include some more master's programs and more undergrad degrees. So it's pretty exciting. I don't know, it's cool. So in the long run, it is a big commitment. It's a time commitment for sure. I mean, I'm year 6 of 7. It is middle school and high school combined. I'm doing it again. But it has, honestly, it's flown by. It's been crazy. I can't believe I'm here.
It's awesome. Let me think.
I don't think I talked about the finances of it. I can talk about that a little bit. Sorry. So financially, like I said, I got a decent amount of scholarship from my school. I did well on my ACT. So that kind of put me in that bracket where I was able to get a bit of financial assistance. It's expensive though, I'm not gonna lie. The average pharmacy student will graduate with over $200,000 in debt. But when you think about it, the long-term return, pharmacy is consistently rated as the best investment for your money when it comes to college degrees. The starting salary for a community pharmacist is anywhere between $110,000 and $130,000 a year based on, where you're located. And right now in St. Louis, I think the starting is $124,000 a year. So it's definitely if I'm going to be making that for the next 40 years, I'm sure this debt will be able to be paid off pretty readily. But like I said, it's definitely a commitment. It's something you want to think about. It's something you want to prepare for. And it's something that you want to be sure that you want to be involved in before you're really committed to it. Luckily, there are tons of different things you can do in pharmacy besides even just being a hospital pharmacist or a community pharmacist. You can go into research, you can go into drug development, you can work for the government, you can get a law degree, you can, the list is endless. There's positions everywhere.
Awesome. Yeah, I think that, you kind of pointed out I feel like the obvious, I guess, if you're working with more debt, it's good to have a career that that you're going to make more money. So
exactly. It's not going to school and spending all this money and then not being able to find a job. That can be a really, really scary thing, especially right now. It's something that's on everybody who's going to college's mind. Like, is this degree going to be worth it after graduation? And luckily, I still believe that pharmacy is going to be worth it after graduation. There have been, talks about the pharmacy field getting more niche, so to speak. There being like a flood of pharmacists in recent years because about 10 years ago, there wasn't enough pharmacists. So everybody decided to go to pharmacy school. But it's much more just like being flexible, being willing to potentially move if that's what comes down to it, being able to go to communities that are underserved and taking care in those situations where, maybe it's not within 5 hours of your family, but hey, like you're going to help people and you're going to, experience the world in a much more broad fashion. And I'm here for it. I'm excited for that.
Awesome. And then let's go ahead and talk about a little bit about the curriculum, I guess. So what has the curriculum and the classroom experience been like for you? Specifically, maybe how hard has it been? And then also on the flip side, I guess like what gets you through each year?
Sure. So undergrad was pretty straightforward. I took a lot of writing classes. I took a lot of communication classes. Like I said, my undergrad was in health humanities. I decided that my pharmacy degree would prove that I was good at science. So my health humanities degree would prove that I'm decent with people. So we'll take that. And then when I got into the professional program, it kind of flipped. I quit doing as much writing and it became much more like core pharmacotherapy courses with a few electives sprinkled in. So our core pharmacotherapy courses basically focus on one disease state at a time. So for example, when I first started, we took like an intro to patient care course where they kind of just went over a bunch of random kind of disease states. We talked about, like sun care and acne medications and basic over-the-counter pain stuff, Advil, Tylenol, things like that. And then the following semester, it got a lot more intense and I took my first like core class. So I took pulmonology. And that's when I learned about all of the different inhalers that are created, all of the different, the differences between COPD and asthma and emphysema and all sorts of things related to the lungs. I've taken cardiology, gastrointestinal diseases. I've done infectious diseases, hematology and oncology, so cancer and blood disorders. What did I just take? Oh, I just finished up my neuropsych class, which, they're rapid fire and they break them up into like I was in neuropsych for 8 weeks and it's 5 credit hours. Like we're going. And that was the same with cardiology. It was super fast. GI was 2 credit hours in 2 weeks. So wow. I'm spending, the whole time basically learning these disease states and the drugs that are associated with them. And we're not just learning about the drugs. We learn how to assess the patient. We learn how to recognize different signs of what disease state the patient might have, even though it's going to be primarily doctors diagnosing patients and stuff. Like it's very important for pharmacists to be able to understand why the medicines are being prescribed for this reason and how to best tailor the medications to the patient use. So the curriculum itself has been demanding. It's a doctoral program. Right. I'm a full-time student. I work part-time. It's a time commitment for sure, but it's completely doable. All of my classes offer what's called remediation. So if I were to fail an exam or a final, they give you one shot to redo it. And if you pass, it doesn't matter what your grade is, you're going to get a 70% on it, which is your bare minimum passing, but it's a pass. So the professors are really helpful. Everybody wants you to succeed. Nobody's there trying to make this impossible or make it a program that's going to, result in failure. So like I said, it's doable. It's definitely doable. We're here, but it's hard.
Great. And then I know you mentioned a little bit about working in a community pharmacy. Would you be able to talk a little bit more about that? And maybe if you had any other internships or experiences that you think are going to really help you once you finish your doctorate degree?
Sure. So yeah, I have been working. So are you familiar with the grocery chain Schnucks? There's
Yes.
one in Peoria, I think. So they are everywhere in St. Louis. They're like, the Walmart Aldi combo. Like there's one on every street corner. So I was working in a Schnucks pharmacy since 2018. And last June, we were purchased by CVS. So now I work for a CVS pharmacy inside of Schnucks. And it's been a really rewarding experience. I think it has taught me almost as much as being in school has taught me about pharmacy, because it has given me this like direct patient contact. In my, I guess that was my second professional year. I was actually, I think that was my first professional year. I don't know, the years have blurred together. I became vaccine certified, so I can immunize, and I can do that at my job with the supervision of the pharmacists and stuff. So that, it's just like, it's all part of it. I'm able to, counsel patients on new drugs, which gives me practice for the tests that are coming up. Oh God, my dog just ran through the door. Gives me practice for all the tests that are coming up. Ooh, they might be barking, Jacob. We might have to pause this. I'm so sorry. They're going to get really loud.
Yeah, that's okay. Yeah, I'll go ahead and pause it real quick.
Okay, pharmacy. Cool. Sorry about that. My community pharmacy job, like I was saying, it's given me a lot of direct patient interaction, and my pharmacists have been able to tell me like what works best for them and how they go about their process of verifying stuff. And, I've gotten to learn directly from these really, really awesome pharmacists, which has been really cool. In addition to my job, becoming a pharmacist, you have to do a bunch of experiential education. So my very first experiential program, I went to a Walgreens pharmacy actually, and I worked there for 3 weeks over the summer. I paid to work there. And that was really cool, because I got to see an entirely different, setup, a different computer program. I met new people, and the people that I've met have actually continued to be like mentors to me, specifically the pharmacists that I was working with there, which is really, really cool to like get out into different zones and meet different people. I did 3 weeks at a hospital as well in O'Fallon, Illinois, where I was able to see, the entire side of the health system pharmacy that I hadn't been exposed to yet. And I just finished actually, so we have to do little ones during the semester. So earlier this week, I was doing a transitions of care rotation, which is essentially focusing on admissions and discharges and all of the different, shuffling that goes around during that, and the role of the pharmacist to make sure people's medications aren't being messed up. If they're getting changed, we are the ones that are facilitating those changes and making sure the patients and the families understand the changes. And I was at a pediatric hospital that's called, it's the Rankin Jordan Pediatric Bridge Hospital, which essentially means they are bridging the gap between the hospital and the home. So they are providing, care to children who require, a little bit more intensive care, but they're pretty healthy. They're recovering from surgeries, or they're recovering from illnesses. And it was basically all transitions of care, all they deal with is admissions and discharges. So that has been, it's just been a really rewarding experience. I've gotten to see so many different things, and I'm really excited because we just got our rotation schedules published. So on my last year of school, year 7, I will be done with classes this May. I'm never going to take a class again. My last year, though, I will be completely experiential. So I will do 8 5-week rotations at different pharmacies in the country. I'm lucky enough to be going to Littleton, Colorado for one of them, where I'll learn about geriatric pharmacy and compounding. I'm also lucky enough to be doing a rotation at the Metropolitan Psychiatric Center, which is really exciting. I'm learning from some of the coolest professors I've had. Like I'm pumped. It's going to turn out really well.
That's awesome to hear. So, hang on. Sorry, I was trying to get this window out of the way. Okay, there we go. No, that's awesome, and I think that's interesting to mention about the discharging and everything like that, and the transitions, because yeah, my daughter, when we were in the hospital for her Rett syndrome and everything,
Mhm.
yeah, it just seemed like the doctor said this is what you get and everything, but we didn't really realize it was an actual pharmacy that they went through everything until we left.
Yeah, no, and that's kind of it ends up being like 54% of medication errors are directly related to admissions and discharges. And it's like pharmacy's job to make sure we're not making those errors, because medication errors and other preventable things are responsible for too many deaths and too many illnesses and errors coming about. So it's my job, my duty to make sure that those things don't happen. And it becomes increasingly more important, the more complicated disease states become. And that's kind of where I found like my niche, my passion is like in managing these complex disease states and figuring out exactly how to help people in the best way possible. And I think that's really like what has been my driving force towards this end, is making sure that I'm going to be able to make as big of an impact as possible in people's lives.
But you're definitely you're doing a great job.
I got a lot
Um,
going on.
and on that note, talking about niches, is there a specialty or a subcategory of pharmaceutical medicine that you're most passionate about or you're most interested in as of right now, currently?
Yeah, so my mom went back to school in her 30s and became a nurse. She was an oncology nurse at OSF for several years and is working in the infusion clinic now, across the street. So she has been a huge inspiration for me. And when we were growing up, we would always take poinsettias during Christmas time to the different families who had lost somebody to cancer that year. So it kind of really gave me, like a special seed in my heart where I wanted to do more with cancer patients. Um, Luckily for me, I also found a niche with medical cannabis. So in Missouri, it was recently passed that medical cannabis was going to be, approved for a list of disease states. And cannabis has been shown to be consistently efficacious at increasing appetite in cancer patients, and it has anti-nausea and anti-vomiting properties for cancer patients. There's a few synthetic cannabinoids that are already turned into medications that we, use for patients, when there's actually just like a plant that is able to be used for these same folks. And so in order to like combine my two passions, I'm really trying to become an expert in this kind of baby field that hasn't really had time to grow yet. No pun intended, time to grow. So like I was saying, there's kind of like a lot of pseudoscience present with medical cannabis right now. You go to these medical cannabis dispensaries and it's people getting paid $15 an hour trying to recommend what is going to be best for you. Well, what makes logical sense to me is the pharmacist should probably be recommending the drugs. Considering we're responsible for all of the other ones, it doesn't really, it doesn't really mesh that I wouldn't be taking on this role as well. So I think it'll, allow me to kind of set myself apart from the field. It's going to give me the capability to use my entire background of knowledge to really tailor these medication regimens for patients who have a lot going on. Cannabis is a drug. It interacts with things. It has to be taken in certain ways, and it can be really harmful if people don't know exactly what they're doing with it. But it can also be absurdly beneficial. Epidiolex, for example, is a anti-epileptic drug for seizures. It is 100% pure concentrated CBD, which is a cannabinoid derived from the cannabis plant. And there is more and more studies coming out that are saying that this drug and even cannabis itself is able to like prevent little kids from having debilitating seizures. And it's incredible. Like, who wouldn't want that to be going on?
Yeah, and I think that seizure thing is probably well, I know it's an important thing because my daughter has seizures and she takes um, she takes two different medications for that
Mhm.
they kind of have those side effects of like tremors and such. So like you
Yeah.
kind of have to decide what, have the seizure or have the tremors. So like finding new ways to cope with those seizures and help those kids is really an amazing thing, I think.
Right. And so, yeah, I want to add a scientific voice to the medical cannabis, community. I'm based in evidence. That's where all of my, recommendations are going to come from. That's where all of my, opinions are even going to come from, is things that are proven, things that have actual science behind them. And unfortunately, right now in the medical cannabis realm, there's a lot of anecdotal evidence. So stories from people of things working. And while stories are great, stories are not, confidence intervals and p-values and hard ratios that are proving like, yes, this works. This is what it's doing. And the main thing with that is just like the status of cannabis as still, it's like in this weird in-between phase where the federal government says you can't use it, it's illegal, it has no medicinal properties, where at the same time the federal government is approving THC derivatives and CBD derivatives, but saying you can't have this plant, which is, I'll get off my soapbox for a second. But it's just one of those things. Colleges and universities who do a bulk of these, research studies can't get federal funding to do the studies because it is federally illegal. So how do you get massive, trials going? How do you get these hard, randomized controlled trials put together without the money? It's absurdly difficult. So I hope to, use my voice to advocate for descheduling, and then to use my expertise to help potentially maybe someday run some of these clinical trials and get things put together for, future patients to have a better chance at it.
Yeah, I think that's definitely the way to go for sure. Having that science behind it and those trials, that's like the best way. So,
For sure. Yeah.
so then I think we have a couple more that I have put down in here, but specifically, because you mentioned that you're doing vaccines now, have you gotten to do any COVID vaccines at all or anything like that?
So I personally have not gotten to do any COVID vaccines, but I've been involved in a couple different clinics that we've put on. My pharmacy manager actually hasn't been in my pharmacy since I think it was October he left. And he was doing clinic organization. And so there were a few times where he called me and was like, hey, I need help, putting all of this, all of these forms in the computer. I need help typing this stuff. And I was like, yeah, I can come do that. I signed up to be a vaccinator over winter break. But the rollout was, we all know about the rollout. Yeah. So I actually wasn't able to get into a facility until school had started back up. And by the time school had started back up, I was too busy to have the chance to do it. My pharmacy, like I said, is inside of a Schnucks. So we don't have a lot of the infrastructure or the space to be running these clinics. So my pharmacy hasn't gotten the COVID vaccine, but there are different CVS pharmacies and other, pharmacies. Even my school has been given doses and has been running clinics. Oh, they're all during times that I can't, be there though. Mm-hmm. Jeez. How dare they not schedule around me? But, so I've had a really interesting firsthand look to all of it. We're talking to patients every day. I'm a huge educator for my patients, connecting them to resources and getting them signed up for clinics. It's a big responsibility. And what has been kind of wild to me is watching it firsthand. Most of the communication is coming from the internet, and a lot of our most high-risk patients don't even have internet. They don't have a computer. And if they do, they don't really know how to navigate it very well. And so it's kind of highlighted this gap in care between an older generation and the more modern, things that we're comfortable with aren't necessarily the same for most folks. And I remember when CVS first rolled out their vaccine setup, they weren't providing a 1-800 number to patients to call so they could set up. They were like, we're only doing it online. And I think they quickly realized that wasn't really going to work that well.
Yeah, I think we see that disparity in the libraries as well, where we see those people. For a while, we're just doing curbside, and you always get people calling when your computer's going to open, this and that. Especially with those COVID vaccines, it's something that they need our computers to go, because you're right, that those high risk groups are older people and people that can't get to a computer, don't know how to work a computer. So
Exactly. And I'm sure you see it in the library as much as I see it in the pharmacy, is this lower standard of not necessarily literacy, but like for me, it's health literacy. The words that we use in healthcare are complicated. The things that we are trying to describe are complicated. So a lot of things can get lost in translation. And I'm sure you see that same like technology literacy where, you know, even trying to navigate, you know, an internet browser can get really complicated if you're not experienced with it, or if you have never been shown how to, you know, use it. So I think our roles kind of overlap in that sense, where we're trying to facilitate, you know, proper usage of terms and proper usage of resources in order to, you know, help folks. And I think that's really cool that the library and pharmacy kind of overlap in that way.
I agree. All right, so I think you kind of already, well, I don't know. I'll ask you it anyways. You decide if you've answered this question or not.
Okay.
Why do you believe it is a great field for students to explore?
Oh, yeah. It's a loaded question, but I think I've hit on a few of my big, you know, components with it. I just think it's really rewarding. I think it's special. It has allowed me to combine like my love of science with my love of people. It's, you know, allowed me to challenge myself and to get familiar with things that are absurdly unfamiliar. You know, like I was a teenager when I decided to get into this program. I've matured with the program. It has taught me, you know, to work hard and to, you know, believe in myself when things are whack. And I mean, it's been really, really cool. I think most folks would feel rewarded doing what I do. Like I said, though, it's not for everybody. If you know, don't like science, like don't come to pharmacy school because it's all science. But, you know, I think in the long run, it's going to set me up for the goals that I have, even in my personal life. Like I want to have a family someday, and I want to make sure that I can take care of that family. I want to have flexibility in my life where I get to see different parts of the country and different parts of the world. And I think that pharmacy is going to let me do that. And that, I mean, it's a cool setup.
And then, do you have any last words for of encouragement or advice for people that are considering pharmacy?
Words of advice or encouragement. It was a long time since I applied to school, but I would recommend researching early, going on a lot of college visits, seeing different places, and seeing like what program is going to work best for you and your situation, because, you know, it's all different customized bits. I think in the central Illinois area, you can come south to St. Louis, you can go to Indiana, and you can go north to Chicago. And all of those areas have very cool pharmacy programs that will help you, you know, like move forward in your own personal goals. There are, you know, don't blow off your ACT. don't do that. Because I think that's the score that I was able to get, like really helped me, you know, stand out and solidify, you know, a position. But also, like, I have classmates who didn't do as well on their ACT and wrote an admission paper and was able to, you know, really impress people with their work ethic and their you know, college or their high school grades, and that helped them get into school. So it's not, you know, just one thing or the other, but it's just taking it seriously. I mean, you're preparing for the rest of your life right now, and I'm glad I made the decision that I did. I don't think that I necessarily at the time had taken all of the steps I should have to make that decision, but I think I made the right one.
I think that's kind of how I don't know if you can make the perfect decision in the moment when you're
those
only
don't exist.
18 years old coming out of high school. So
yeah.
I think that I might be wrong. I might just be saying random things, but I think that they take an SAT now instead of ACT.
Oh, really?
Even in Illinois, yeah.
What? Okay, well, I don't know what a good score on that is, so try your hardest. I think over 1,000 is like the bare minimum, so it's fine. Wow, That's crazy. They really changed it?
I think so.
Am I old? Is this what old feels like?
Everybody's always checking out those SAT books at the library, so
Oh man, well,
they've
very
at least
cool.
made it an option.
Okay, got you. Well, don't blow that one off either. Oh gosh, my dogs are on it again.
All right, well, I appreciate you coming on, and hopefully this was beneficial to anybody that was watching. And this, well, yeah, this is going to be posted Wednesday, but anybody that's watching is going to be watching it on Wednesday. So,
okay, cool. If there's anybody who needs to contact me or wants to have, a deeper conversation about this, or even ask me questions about my school specifically, you can reach me at cassidy.troup@uhsp.edu, which is my, my school email. So go ahead, send me a message. We can talk about a lot. There's a lot more that we didn't even cover today. So, we can talk.
All right, well, thanks everybody for watching. Bye.